The idea of street medicine in Phoenix is to meet the unmet needs of individuals who are experiencing homelessness around the Metro Phoenix area. So the idea is that you have undergrads from Arizona State University who are paired with graduate students from either Northern Arizona University or the University of Arizona College of Medicine in Phoenix, who are then basically paired up with a clinical preceptor. And when they're out in the streets, they're able to learn from different disciplines about how to approach a specific task.
Since my undergraduate days, I've really been interested in underserved populations, whether those are on the border of Mexico or downtown Phoenix locally. I've always been doing work that serves the underserved.
Our original goal was basically to focus on providing healthcare services, but from our health needs assessment, we've learned that it wasn't a #1 priority for many individuals experiencing homelessness. And in fact, there was other concerns such as transportation, shelter, housing, and so forth.
I was really inspired just kind of walking the streets of downtown Phoenix, saw such a huge need, and doing a little research, we realized, there are a lot of great programs, but there's not a lot of inner talk between the programs, not a lot of crosstalk. And then once we learned about street medicine in Detroit, we thought that was the perfect solution to really bridge all these great resources together to provide one kind of common force that's working to help the homeless in Phoenix.
We like to think of this from this perspective. We want to break stigmas. We want to help individuals overcome stigmas.
Circle the City goes to a lot of clinics and food banks and other areas and provides those services to large volume individuals. But they miss a lot of the marginalized homeless individuals that don't access resources. So Street Medicine Phoenix is able to traverse those parks, go to areas where a mobile van is not able to go, and provide services. We kind of went into it understanding that building a relationship is huge, but when we were actually talking to individuals, we realized how close-knit the homeless community is, and that when we encountered one person, had a good interaction, more people would come up to us spontaneously and want to have an interaction. So it's a lot of word of mouth in this community, very tight-knit. We really have to build relationships one step at a time, and making sure that each encounter that we have with everyone is meaningful and impactful. And then Street Medicine Phoenix can really have a good impact.